Hi, my name is Tyler Loxley. I'm a physician assistant over at Joint Implant Surgeons of Florida, working specifically with Dr. Edward Humbert. Thank you for choosing Dr. Edward Humbert and his team at Joint Implant Surgeons of Florida. You've just underwent a joint replacement surgery. Now what do you do and what are you expecting? There are some things that are extremely normal after these surgeries. Pain, swelling, stiffness, bruising are all extremely common things that we see following a knee or hip replacement surgery. Lots of ice, lots of elevation can help with this. So we recommend that you elevate the leg above your heart if you can for 20 to 30 minutes out of every 3 hours if you can. The bruising, swelling, and pain should all begin to go down after the first 1 to 2 weeks. We are on your side. We want you to do well. We have a list of medications including narcotics, anti-inflammatory medicines, Tylenol, and nerve pain medications that we prescribe to you after surgery to help keep you as comfortable as we can. Everyone is a little bit different, and your bodies respond to these surgeries in different ways. So some patients are going to swell a lot more than others. Some are going to look like they hardly had surgery, while others will have a severe amount of swelling after the first couple of weeks. So just remember that not everyone's the same. If you talk to your friend's experience, it may not be the same experience that you get after these surgeries. So if you have any questions or concerns, obviously we're available to you at any time. The number one goal in mind after these surgeries is just to be safe. So we want you to use your walker for at least 2 weeks afterwards, whether it's a knee or hip replacement, just to be safe. We've seen a great deal of complications coming from patients that don't respect the surgery and they think that they're ready to do things before they really are. After these surgeries, your leg is going to be weak. It's not going to want to work the way that it normally does. So always just remind yourself to take it slow, step by step. Just make sure that your walker is always there for you. We don't want you to have any falls or trips and end up with complications that could have been prevented. After your joint replacement surgery, we like to get you set up with physical therapy. This can either be done in an outpatient setting or with home health physical therapy. Some insurance companies will have a home health physical therapist that can be arranged to come to your house over the first 4 weeks, approximately 2 to 3 times per week. Other insurances do not cover the home health physical therapy, and for you, we like to get you straight into the outpatient therapy, either at our office or at a physical therapy office that is close to your home. The goal with the therapy is just to improve the range of motion, help with pain, and help with you safely doing your activities of your daily living that you need to do at home. Again, your therapist will be the one that transitions you from your walker to the cane, and then also transitions you from the cane to no longer needing an ambulatory aid. After your surgery, it is okay to start showering after 3 days post-operatively. While you're in the shower, we like you to keep the incision covered the best you can with some plastic wrap, saran wrap, or press and seal over top or around the incision to keep it nice and clean and dry. We don't want you to put any creams or ointments onto the incision until we see you back in the office at 4 weeks post-op for your follow-up visit. The soaking underwater is the key thing that we want you not to do over the first 2 to 3 weeks. So pools, hot tubs, bathtubs, things like this are all things that we do not want you to do for the first month after surgery. Again, showering is okay, just keep it wrapped, keep it dry. If you do happen to get some moisture on it, just pat it dry the best that you can. Thank you for choosing Dr. Edward Humbert and his team at Joint Implant Surgeons of Florida.